which is called Healers Clinics. As my colleagues explained, this is an integrative care center. So we have Ayurveda, modern medicine, and homeopathy, and different systems from Europe. So this is an integrated center which we are running here. Now, we have been in UAE for the past 19 years, and we have been practicing exclusively Ayurveda for 15 years. And this is a clinic which is 5-year-old, which is an exclusive center opened by my family. Now, we are lucky to have this space or placed here in this region because we are sitting in one of the trade route of ancient India and Middle East and Europe. So historically, I just would like to run through a history. This is where we are sitting, and you can see how important this place in transferring the knowledge system or a trade route still in current situation as well. Now, without very major strategies in the past, we have been very successful in doing that, the knowledge transfer and trade routes. Now, it is becoming more and more evident that we could be doing little more precise strategies for getting Indic sciences and its related trade to different countries by sitting in this region. And we are convinced about it. Now, looking backward into the history, we see that there are a lot of knowledge transfer happened. Why it is important or relevant to this discussion is that we need to look at how strategically it has been, or unknowingly strategically it has happened in the past. So when we try to trade, or when we try to give the system to a different country, like my colleagues have already suggested, that there are a lot of issues which is happening, like cultural blockage, or awareness issues, and etc., or acceptability part. This route, and if somebody is looking at the history, we can look at it and we can build a better strategy for doing this. So that's why history is important. We have been used one way when we say that, I don't know whether it's the correct word to use, but we have been utilized in the history for the knowledge hunt. But now we have been going to the West or the Middle East part, selling our product as if something which has new thing has come to their lives, which is not true. So historically, looking to the major sciences, Charaka and Sushra has been actually translated in 16th or 17th, 6th or 7th century already. So Baghdad has been, this is gentleman who is sitting here, his picture, who was very instrumental in getting the things translated into Arabic world. Charaka Samhita has been translated into Persian, subsequently into Arabic by Abdullah ibn Ali in the 9th century. Then Khalifa Harun al-Rashid, who is seen in the picture, translates Shusra to Arabic. Now, we need to go back and look at this culture, where what kind of strategies we could use in the modern world to make sure that the science is being sold as a whole, or being presented as a whole system rather than a product of a bottled product or something else. Because science is degrading if it is not being sold or presented as a whole. So that is, history is very important for us. Now, it is not Indian sciences, I mean, not only Ayurveda, many other sciences have been taken and we have been forgotten. So we need to have some kind of a revival strategies on this in a very serious philosophical aspect as well. Now, these are some examples of this one. Now, let's look at the Middle East scenario, just to give you a quick review on what's happening in the region. The Qatar is a semi-regulated scenario. And what you see in the picture, the Qatar has opened one first clinic, was a lady doctor, and it has been accepted now, and she started functioning now. But only one clinic has been started. I don't know what method they have used, but it's only a semi-regulated thing. So there could be some kind of an influence has gone into, but they are opening up. So for moral of the lesson is that they have opened up. Internal medicines are not yet allowed. No import of Ayurveda products are in place, which means that as a medicine or as a supplement or as an Ayurvedic product, there are no regulations yet. Now, TCAM, this is just to talk about Riyadh, so the Saudi Arabia and Bahrain. Again, TCAM departments are open, but no clear guidelines in place, hence not regulated. stringent measures if practiced as healthcare. So again, the terminology is what you use of a cure or alternative or a doctor or something, the people get into trouble. No legal import options available for the medicines. So whenever we have clientele traveling from that area, they take it as a personal baggage. They cannot take it as a medicine or a supplement. But we have been seeing that there are active participation in AYUSH and WHO conferences by these ministry officials from Bahrain and Saudi Arabia. So they are actively in the mode of looking into this, but there are no bold steps yet. Now, coming to Oman, it is now regulated by Ministry of Health in Oman. Licenses are issued for practitioners after examinations, which means that there is a clear steps, at least in the beginning stage. Medicines and oils are available in 2 stores, which are basically of Kottakkal and Coimbatore products are available. But the routes they are getting it, it's not yet very clear. So it could be some influence and etc. used, but it's not something which is as an OTC or a normal registered products. But Himalaya products, as like any other part of the world, it's registered. So people are also prescribing it. Now, exclusive clinics are permitted, which simply means that an Ayurvedic practitioner who is licensed is given a status in the society and people can approach them for help. Now, there are no inpatient sections, and around 70 Ayurvedic physicians are practicing after this licensing process. This is a report from Oman. Now, United Arab Emirates, this is the first country in the region to put down regulations in a very bold manner. Highly dynamic regulative structure in place. Less than 200 licensed practitioners works in the country. And we have an organized association. We have organized in an association. It's called EGA, Emirates Ayurvedic Graduate Association. Now, we have independent clinics running with licensed Ayurvedic practitioners since 2001. Now, just to give you some kind of an idea how this has been evolved as a regulated mechanism, if any country or somebody who is influential in an advocacy mode, there is good model from UAE to explain. They started an herbal treatment center. Sheikh Said was one of the lover of plants and herbs and traditional medicine, and he had that feeling for India as well. Now, medicine practice decree was amended to include other medical systems, traditional medicine, acupuncture, herbal medicine. Then Ayurveda followed later. Then federal law was passed by him. Then it goes on till 2006. There have been very good improvement. Basically, in the dynamic process was very well alive. Now, there are two bodies which is controlling all this. One is a federal body, which is in 7 Emirates put together. So it's called United Arab Emirates. So Dubai Health Authority is something which is locally managing the Dubai Emirate. So they have certain refined rules, but they also accept the federal rules. So most of these practitioners are coming through a federal examination route run by Ministry of Health. Now, since 2004 and 5, I have been a part of, or I have been very little, at least the way we could, in the part of making the guidelines and etc. in the policy making. And also the WHO, we have been sending a paper from here on WHO's traditional medicine atlas, where our good friend Jerry was a part of it. So we are communicating from since then. So we have, what we are trying to tell you is that there is some very well researched, or at least in the dynamic level of research has happened to in UAE for some good practitioners and officials from the government sector who has a feeling for the herbal traditions. So this could be an example to look at in a historic aspect of it. Now, this is a scenario. I just wanted to give you some examples of how the clinics are looking like here. Just want to tell you that the clinic has its own social acceptance, and the clinic has a healthcare community or family health clinic kind of a setup. Acceptance is there. So we have that respect as practitioners in the country. So this is something example which we can take, and how this process has evolved, which will be a good example to take up. Now, this is just example I have given my clinic. There are some photos I wanted to add from the other clinics as well, but the quality was not bad, not that great. So I just put my own clinic. Now, the medicines, so-called, we call it here supplements. and etc., or herbal or ashab, which is from the herbal traditions. These products are coming here. It's still a mystery because there is a gray area, like Doctor was saying that there are a lot of, Dr. Intu was saying that there are so many things goes underground kind of a thing. So we also feel that there is, mafia is a bad word, but there is a kind of a, people involved in smuggling and getting the things in a local market. But when we go and see and look at the authority and ask them how this is being imported, can we also have some kind of a paper that this is properly done and there is some kind of a mechanism? But there is no clear answer. But you go with a prescription, you go with a paper of request, this is available in the stores. So how this process is being, we are just chasing because we are in the process of getting something granted for the practitioners to have their own freedom of prescriptions. And they also, the people, they are keen to have their own preparations made at certain level. We are trying hard for that. So we are just chasing this process. Most probably in another 6 months, we'll have some good news on how this can be done or how this can be properly legalized, and you can make a prescription and you can import the medicine the way you want. But these are the pictures. These are locally collected products which we usually use in the clinic and given. As Dr. Jeevan very appropriately shown that most of the things we have a problem, sometimes we are shy when we give these medicine to the people and saying that this is Ayurveda. Most of the time, this is kept in improper situations, sold in some kind of a gray market kind of a place, or in between rice and that and this and etc. So we need to have that kind of certain respect to our products. Like, this is one of the tools which we should have, or for a sustainable practice in the country or a growth of the science. So resources part, we are still in an infantile stage. We need to, but everything is available. Looking at the proximity of the country to India, everything is available. But it is still, we don't think it is still in a proper manner. So we need to still do a lot of work on this. Now, our challenges and opportunities to talk about approval of pharmacopoeia is one of the challenges. There have been rounds of discussion after PM has visited, and there was one conference in Dubai. So there was a lot of AYUSH dignitaries present. So we had rounds of discussions by other colleagues. So we are still awaiting for a pharmacopoeia approval. Then things will be much more easier, or at least we'll make some kind of improvement towards the resource availability. Now, approval of classical medication through a proper channel. So what it means is that we need to have these medicines not bought from a gray market or anything, so that it's properly available in certain kind of something called Ayurvedic store or a herbal store or something with all our approved medications. Now, hospitals could be one of the areas which we are looking keen on having somebody. Now, it is people like us are working from Dubai as place of connectivity. We always coordinate with the hotels close by so that the people can come and stay and for 2 weeks or 3 weeks, and people take treatment was, and we do a kind of and drop kind of a thing. So at all, there is a facility which is known as an Ayurvedic exclusive facility that would be wonderful to have. This is something which we are looking at. So this is a challenge to convince, but we are trying out to do that. Now, education part and continuing education part, looking at the practice, propagation, research triad, that we need to also have this as a hub of education, because things are opening up. Because it is between the India and the Europe and the multicultural society, something to do with the education, proper education, like the same rigor as what Jeevan was saying, Dr. Jeevan was saying. So we could have some kind of a hub on education and a continuing education possibly in Dubai, or UAE in general. Now, we have a challenge because, sorry to say this, because Ayurveda has been seen as an oil tradition, massage tradition, hair massage tradition. I don't know what is Indian hair massage means. So there are things like that. This is part and parcel is being sold in the market, and that has spoiled our life. So we need to look at, not spoil our lives, but basically the science, things are getting damaged, and it's a very personal view. And what we feel that there could be some kind of an intellectual property, kind of an awareness on when somebody is using Ayurveda, what it really means. So the definition has to be, as Dr. Jeevan said again, we need to have some kind of a definition of what Ayurveda means and or what it is not. So that is still. So awareness as a healthcare system, this has to reach to the public, where, as I said earlier, that the history has to be studied well so that we can reach them and we can really connect to the codes and culture, and it's going to be extremely easy, not like other countries where you have referred in the past. Now, a strategic approach in advocacy in regulatory system, accreditations and etc. has to be initiated. I don't even feel that we have made even a solid step yet. So this is something which we'll be looking at, and as an organization, we have also been discussing this. As an eager organization, we have been discussing this, how to do this in a more strategic and influential manner, where the governments can, or the person from here can talk to our person from the country and have some kind of a strong association. Otherwise, most of the things are happening like a festival or a mood, and everybody's emotionally hyper, then we leave it there. So there are no follow-up on this one. So I'm not saying that nothing has happened. Things have happened, but there was no follow-up. And it is unlike the UK or any other countries, Germany or etc. This is much easy if we are putting a lot of effort into it, or a concentrated effort into it. So something which is there in our agenda as challenges. Now, a stronger collaboration with authentic Ayurvedic institution and stakeholders and AYUSH needs to be in a material form. It happens as a communication or anything. No, we can have a body set up here because it's much easy. It's open. It is pro research. So things can happen in this country. So we need to have some kind of a
yes, doctor. Dr. Hafeel, we can't hear you.
Hello, Dr. Hafeel.
Dr. Anil, any technical problem, Anil?
From our side, no, sir. For the time.
Dr. Hafeel, please unmute. Dr. Hafeel, please unmute.
So
okay.
Yes.
I was all this time I was just not audible.
Yeah, you are audible. You are audible. You are audible.
Okay, now opportunities. I believe that you have seen this slide, challenges.
Yes.
Did you hear me on the challenges?
No.
Yes.
Did you hear
just
me
heard the challenge? You must start challenges.
Okay, great. Okay, now approval of pharmacopoeia is one of the challenge what we have. Approval of classical medication through a proper channel is one of the challenge, because we don't want to hunt. As a personal experience, if I have to share with you, is that when I was practicing in the beginning, I have sent one important man with a prescription, and he came back and he said, "Doctor, are you really sure this is what you prescribed and this is the place I should be picking it up?" So, which means that this may be somebody saying, some Ashraf saying, "Please wait, Baba, let me go and check in my go down," and he picks up and he comes with the 2 bottles of oil from Kottakkal, and so there is no kind of an image yet developed for Ayurveda as a proper channel of herbs or something to be collected from a shop of its own. So that is a challenge. Approval of Ayurveda hospital. It doesn't mean that there is no shop. There are shops, but still it could have a better image. That's what I mean. Approval of Ayurveda hospital is a challenge. We should have some hospital. Now we are coordinating with the nearby hospitals, because we get a lot of Scandinavian, or when the season is improving, the people from the cold countries come here. We have repeated clientele visiting us. So we need to put them in a hotel. So we have different types of hotels here. So we find something and put them, and we do a pick up and drop. So if at all we have a hospital scenario and it is recognized as an Ayurveda hospital, there is a good scope. So this is something, a challenge. Somebody has to take an initial step. Now, education and continuing education. Somebody needs to make a noise in between so that I know that I am with you guys. So,
yeah.
Dr. Anil?
Yes, doctor.
I am audible still, yeah?
Yes.
I have no other way of
Your
identifying.
screen sharing is not on, but I think you can speak. Yeah, it's fine. Yes.
Okay, so education and continuing education is one of the things which we still, Dubai has a kind of a lacuna here in terms of Ayurveda and traditional medicine education. So that is something which is a challenge. Someone has to make an initial step on this one also. And awareness as a healthcare system in local public. So looking at the cultural thing, what we have just explained, that these healthcare system, Ayurveda needs to get into people's healthcare system. I mean, their awareness that as it is a healthcare system, because it is given in bits and pieces, whether it is good or bad. It has been seen as a oil traditions and etc. Massage tradition, head massage, kind of Indian head massage. So Ayurveda name was coming into the market or to the people's head as different kind of concepts. So it has to be seen as a healthcare system. That is one of the challenge we have. Now, this is not complete, but people like us, the IGA, the organization which we are working with, we are trying our best to get this into people's thing as a holistic system of healthcare. So not just an oil massage kind of a thing. So that is also a challenge. Now, there should be a strategic approach in advocacy to regulatory system, and there is also a need for accreditation. I think that Dr. Indu Ravindranat's presentation was some kind of an eye-opener, and we can see the things are happening at some places. We can take some models from them and take learnings and can take it to the people. They are looking into the advocacy part of it or regulatory part of it. Now, we also need stronger collaboration with the authentic Ayurveda institution, stakeholders, and AYUSH. Yes, there were a lot of meetings and festival kind of things and organizations, and we also had in the past, there is a global Ayurvedic meet and etc. in Dubai. But think there are no follow-ups for this. So if we can do that, as the government is very open government, but we need to go with a solid plan. So if we have a collaborative effort and a physical unit or a physical functioning model in Dubai or UAE, anywhere in UAE, that would be great to have. And it's a challenge to get the people on board and start doing this. So this is another challenge which we are facing, so that there is a representative thing, or at least something which is happening, or which has got some its own organs to start functioning in the Middle East. It will be a great thing to do. Now, what are the opportunities in the Middle East? As I said, that we are in the middle, and it's a pathway to East and West. So, and there is 160 country people living here. So anything which is already developed in situ or something which is in the pipeline, it can have a reflection in UAE, and it is much easy for you to export, or much export in the sense not a physical export, but the idea, concept, and philosophy and the product itself can be exported to the things much easier. So you get a visibility, better visibility, and testing waters. This is a place to do it. Now, it can promote greater brands with world standards utilizing preventative care, which means that
Dr. Hafeel,
Yes.
Excuse me, your presentation is very informative, but can you make it little faster?
Yeah, I'm just done. This is my last slide. So So this is a great place that you can promote the brand, and you looking at tomorrow's requirement, which is a preventative care, definitely after the COVID and etc. And this is a place you can test your waters. Now, so MEA, that the Middle East and Africa could be a hub of collaborators. Anybody who wants to do Ayurveda practice, promotion, or research triad, this is a hub from the Middle East, a hub. It could be the Middle East hub. And it's a welcoming environment, and it's an innovation and anything to do with innovation and trade. This is a welcoming hub. So these are the opportunities of United Arab Emirates. And thank you so much for listening to me. I know how it was a broken presentation, but I'm really sorry about it. I don't know what went wrong. Now, if there are any